It gives me a great pleasure to be with you this morning, afternoon, or evening. And I say to all of you, good morning, sabah al-khair, masa al-khair, and bonjour. On this very auspicious occasion, the International Day of Families, it is the time to pay tribute to all the families across the globe and honor them for their religion and also their great efforts, heroic efforts, to protect their children and safeguard their well-being during the global pandemic humanitarian crisis. I will speak today on the response to COVID-19 for families and children that live in fragile and conflict-affected settings and the importance of early childhood development. The COVID-19 outbreak exacerbates existing crises and further violates vulnerable families and children's rights. We know now that 250 million children live in areas affected by conflict. We know that 29 million babies globally were born in areas affected by conflict in 2018. And an estimated 3.7 million children live in refugee camps or collective centers. And now we have 60% of all children live in countries with a full or partial lockdown due to COVID-19. But for families and children living in conflict, affected and fragile settings already that struggle with limited access to health services, including vaccination, and virus-related containment measures negatively and impact their already volatile safety and access to education. With schools and childcare centers closures, young children learning, nutrition, and hygiene suffers. For hundreds of millions of children, these closures can mean going without day school meals, clean water, and sanitation facilities. Pandemic-associated movement, restriction, and economic insecurity are likely also to increase child labor, sexual exploitation, and trafficking, thereby perpetuating cycles of violence. Furthermore, more children and abusers than ever are online and heightening the risk of exposure to cyberbullying, hate speech, and sexual exploitation. Hence, there is an urgent need to protect children from violence amidst the pandemic, which compelled in April 22 leaders of UN agencies and international organizations to call for united effort to protect children in this crisis. As to families and children on the move, even in the absence of pandemic, uprooted families and children, those living as refugees, migrants, or internally displaced persons face immense barriers to accessing health services and sanitation. The rapid spread of COVID-19 and the containment measures are worsening this already situation, making migrants and refugees disproportionately vulnerable to exclusion, to xenophobia, to stigmatization and discrimination. We know that in camps or in overcrowded detention centers, they often live in deeply unsafe and highly stressful environment with no possibility of social distancing. The pandemic also poses greater challenges for migrant and displaced children and families as they are faced with higher rates of deportation and expulsion. These practices threaten children's rights and are at risk to public health. So what does science teaches us on the importance of early childhood development in the context of COVID-19? The COVID-19 pandemic has produced huge societal, public health, and economic challenges across the globe. Although there is still a great deal we do not know, infectious disease experts have already outlined the steps we all need to take to limit the spread of the coronavirus. But we know that children are in many ways the hidden victims of the pandemic. Parents and caregivers are in the first line of response to protect and support their young children, particularly in a crisis such as the pandemic. Consequently, separations from primary attachment figures like parents, like families, like caregivers, due to illness, to hospitalization or death, will have immediate harmful and long-term effects on a child. Adverse effects also result from economic losses, from lost wages and jobs, to associated food insecurity and the potential loss of housing. These factors are compounded by the psychosocial stress experienced by families, by parents, especially mothers, which seriously undermines their mental health. This is also greatly exacerbate the adverse effect. As a result, hundreds of millions of children are now growing up in the environment conducive to toxic stress, which can impair their development and will likely prevent them from reaching their full development potential. Now, in the response to COVID-19 for families living in fragile contexts, the Early Childhood Development Consortium, which is a global movement of United Nations agencies, civil society organizations, academia, and practice, stand in solidarity and collaborate with the UN Secretary General, with UNICEF, with WHO, UNHCR, and all United Nations agencies, as well as with governments, non-governmental organizations, and all of you, to mitigate the impact of the humanitarian crisis on families and young children. The Early Childhood Development Consortium recommends immediately to invest in quality programs and services for families and their young children that live in situations of violent conflict, military occupation, and displacement during the COVID-19 response efforts. To ensure the essential child protection services are recognized also as life-saving and continue to be provided and accessible. To prioritize protection of families and children who in this time of crisis are susceptible to neglect, abuse, and exploitation. To use mass media, radio, television, and social media to promote psychosocial support to families and children. Also, in the medium term, we recommend that to ensure an inclusive approach for all children and their families, especially also migrants, refugees, and internally displaced persons who have a right to the highest attainable standard of health, including having access to testing, early detection for COVID-19, and the means to physically distance, self-isolate, and take other appropriate physical and mental health measures. To uphold also the rights of vulnerable children and their families. As we emerge from this pandemic into recovery, it is vital to have programs that benefit the families, the children, the communities, and the institutions. And those programs should be culturally sensitive. In the long term, we continue to build on the extensive body of international research on the power of early childhood development to promote peace and sustainable development. Finally, in this global pandemic that warrants the participation of all members of society for containment, and where inequalities become starkly evident and pose greater risks to the vulnerable, engaging families and children is imperative. Early childhood services can be a cost-effective and sustainable way to empower families and communities to interrupt the cycles of poverty and violence, as well as to build resilience and social cohesion, and to build a world of peace. Let us join all in this movement to build a world of peace for all families and children across the world. I thank you.